Preoperative assessment for rhinoplasty. Assessment should include consideration of patient motivation, anxiety, and expectations, analysis of the face, analysis of the nose, examination, and photography, again re-examination. So this is the protocol for the preoperative assessment for rhinoplasty. It is essential to obtain a clear history of the patient complaint and symptom. Identification of any structural, congenital, traumatic, cosmetic, or functional issue is crucial. Any past history of nasal surgery, sinonasal disease, diabetes, psychopathology, anticoagulant, smoking, cocaine use should be ruled out. It is important that surgeon recognizes potentially problematic patient, as high-risk patients are unlikely to be satisfied with surgical result. Who are the high-risk patient? Like Simone patient are high-risk patient. Simone means single, immature, male, overly expectant and obsessive, and narcissistic. These are the high-risk patient. And ideal patient are Sylvia patient. Sylvia means secure, young, who listens to other, verbal, intelligent, and attractive patient are the ideal patient for the rhinoplasty. Some patient having body dysmorphic disorder. Those who are unreasonably demanding or overly flattering patient who insist for secrecy, these patients are also surgiholic. Some patient having body dysmorphic disorder, as describes altered perception of one's own appearance that result in distress. It is subjective feeling of ugliness or physical defect which the patient feel is noticeable to others, although their appearance is within the normal limits. So these patients are called body dysmorphic disorder patients. The use of rhinoplasty improvement scale is helpful in explaining and counseling the patient about realistic post-surgical expectations. Patients should be informed that moving up 1 point on the scale is realistic, but anything more is unlikely. You can see this chart. 80% result is unlikely. The possible result between 40 to 60% only. So if you are getting 40% result post-operatively, then this is realistic, and 40% is more than enough for the rhinoplasty patient if they are the Sylvia patient. So according to this rhinoplasty improvement scale, if you are getting 40% result, that are the good results. So summary of rhinoplasty assessment are: patient analysis, what does the patient want? Is it realistic? Second assessment is facial analysis, symmetry, rule of thirds, and rule of fifth. Nasal analysis, external analysis like skin deviation, nasal length, tip projection, lip chin relationship, dorsum brow tip line, dorsum lateral view, nasal tip configuration, tip rotation, columellar show, and basal view. Internal examination like septum deviation, lateral nasal walls, internal nasal wall, external nasal wall. You can palpate the skin, irregularities, nasal bones, tip recoils, alar cartilages, and spine in septum. Clinical photography is must: anterior view, lateral left and right view, lateral oblique left and right view, and visual view. Then you can do computer morphing, and surgical planning is important. Either you have to open rhinoplasty or closed rhinoplasty or endoscopic approach or combined rhinoplasty. Horizontal facial thirds should be approximately equal. The landmarks defining each third are trichinum to glabella, glabella to subnasally, and subnasally to soft tissue mentone. The Rule of fifth describes the ideal transverse proportion of the face vertically divided into equal fifth. Each fifth approximately equal to the width of one eye and alar base is equal to the intercanthal distance. The skin quality can be assessed by the Fitzpatrick classification of sun-reactive skin types. Skin type 1 is very white, that is always once. Second is white, which usually once. Third is white to olive, sometime once. Fourth is brown, rarely once. Fifth is dark brown, very rarely once. And sixth is black, never once. So these are the external skin quality of the nose. Powell and Hempre describe the ideal angle of the facial aesthetic triangle. The accepted dimension of each of the facial angles are nasofrontal angle about 115 to 135, nasofacial angle between 30 to 40 degree, nasomental angle between 120 to 130, and mentocervical angle about 80 to 95 degree. So these are the facial aesthetic triangles and angles we can use for the rhinoplasty. This is a case of gross DNS to left side with internal deviation of septum on left side, and this is parrot nose. I did rhinoplasty with costal cartilage implant inside the nose, and this is the parrot nose. And after operation you can see this is wonderful lady, and this nose is absolutely normal after operation. So this is called open rhinoplasty, in which costal cartilage graft is kept inside the nose to enhance the dorsum as well as columella. So this is all about rhinoplasty.